Hi, I'm Dr. Helmueller, veterinarian and medical director here at Pet. Thank you for entrusting your pet to us today for surgery. I want to go over a few items on our discharge instruction to ensure that your pet has a safe and uneventful recovery. First of all, they were under general anesthesia today. This can cause them to act a little bit differently than you normally see them. They may be a little wobbly. They may vocalize a little bit more. They may not be what you normally see them as. It's important to provide a safe environment for them once they get home. You want to keep small children and other pets away from them for tonight. If you have a cat, you might want to consider leaving them in the carrier for several hours until they're able to move normally. You also want to offer them food whenever you get home, but only offer them about a quarter to a half of what you normally would so that they don't overextend their belly and vomit. If they do vomit, take the food away, offer it again in another hour or so, and in a small amount to make sure that you don't induce that vomiting again. When you get your pet, you'll see if your dog or cat was spayed that they have a small incision in the middle of their belly, and then they have a tattoo with green ink by that. If your dog was neutered, that incision will be just in front of the scrotum in the middle, and the tattoo off to the side or slightly above it. And then if you have a cat that was neutered, they have two incisions, one on either side of the scrotum. Those don't have any stitches in them, and they do seal it very quickly within 2 days. It's important that you monitor that incision at least twice a day for redness, excessive swelling, and for any seepage. If you see these things, definitely let us know so that we can get them in and recheck that to make sure that there's no infection going on. You can clean that incision with a little bit of peroxide on a cotton ball. It's also very important that you don't allow your pet to chew on their incision or lick a lot around that. That can cause an infection, or they could pull their stitches out, which could cause a huge complication. We do offer the plastic cones called e-collars that fit on them that prevent them from getting to the incision. It's important that this collar go past the end of their nose, otherwise they're able to get around it to get to that incision and possibly cause damage. On the cats, we offer small blue soft cloth collars because they're less irritating to the cat, so they'll continue to eat. So, along with that, you need to keep your pet indoors and monitor that incision. So that you monitor that incision, you also want to make sure that they're not running and jumping for at least 7 days. And also, no bathing or swimming for 10 days. After that, it's fine. You might also want to consider getting them pain medications to take home. While they did have pain medication with their surgery that will last through the evening, additional pain medications will ensure that they are comfortable and they'll heal faster, getting them back to activity faster and less complications. Those run about $2 to $3 a day for your pet. If you had vaccines today and your technician has mentioned that you need to come back for a booster, it is very important that you make it here during that 2 to 3 week time period so that your pet has maximum immunity against the disease they were vaccinated for. Also, if you haven't already agreed to it, really think about getting your pet on heartworm prevention. We live here in South Texas where there's lots of mosquitoes, so both our dogs and cats are at high risk for heartworm disease. The medication for it is relatively inexpensive and also very effective. So talk to your technician a little bit more about picking those up today as you leave. I want to thank you again for trusting your pets to us. If you do have any surgical complications or concerns after surgery, please look at your discharge instructions. On the first page, right here, there's a number that you can call, and that will get you a 24-hour on-call technician that can answer your questions. Also, behind that, stapled in your packet, is a detailed list of our common things that happen after surgery. Be sure to take a look at that. You may end up answering your question before you have to make that phone call. We are here to make sure that your pet does recover safely and without any problems from surgery, so do give us a call if you have any concerns. Thank you.